Hi, everyone. We're about at the hour, so I'm going to go ahead and get us started. And we have our panelists with us here today. We're really excited to get started. So welcome to Conduent Healthy Communities Institute's webinar on digital inclusion for community health. My name's Jane Chai, and I'm a content or community health content expert with Conduent Healthy Communities Institute. And I'm going to be your moderator for today. As you're joining us, please feel free to share your name and where you're joining us from in chat. We also have a poll to help us understand which sector you're currently working in. So after you've shared your name in chat, please complete this. And we do have a really good sized group joining us here today. And all right, so as the poll is launching, let me make sure that gets started first. Perfect. So you should be seeing a poll show up in that right-hand corner there. Perfect. I'll go ahead and start us off by covering a few logistics. So first, you've joined this webinar as an attendee, so you're automatically muted for the duration of the webinar. If you do have questions during the presentation, go ahead and use the chat and send it to all panelists. And that should be at the bottom right-hand corner of your WebEx screen. We'll be reviewing your questions as they come in, and we'll try to answer as many questions as we can throughout the presentation, or try to bring them up during the Q&A time at the end of our presentation. And lastly, we always get asked about this. We will be recording this webinar, and the recording will be made available to you after the webinar. So for those of you who aren't familiar with who we are, Conduent Healthy Communities Institute, or HCI, has been a leader in the community health field for over 16 years. We've conducted hundreds of community health assessments and implementation strategies with partners across the country. We're also known for our nationally recognized platforms that provide continuously updated community health data, as well as social, economic, and education data, and acts as a hub for community initiatives. The HCI team brings both a combination of advanced degrees and real-life experience in community health improvement. For today's webinar, we'll be discussing the current landscape of digital inclusion resources and how community health planners can utilize them to advance health equity. Our team of experts will share key concepts and definitions around digital equity, why community health experts should engage around digital equity and inclusion, and strategies for addressing digital equity disparities. So at this time, I think we're going to start showing the results of the poll. And as I mentioned, my name is Jane Chai. I'm the community health content expert with HCI, and I'll be the moderator for today, so you won't be hearing too much from me. And I have the pleasure of introducing our presenters for today. First, we have Schill, who's the Director of Research and Programs at the National Digital Inclusion Alliance, or NDIA. He is experienced at working with local leaders and elected officials to build consensus and develop place-based solutions to the most pressing community challenges. Prior to joining NDIA, Aaron was the Director of Data and Mapping at the Mid-Ohio Regional Planning Commission, where he headed the agency's work in data analytics, visualizations, and GIS. He also established the organization's strategy and programming for broadband and digital inclusion, and co-led the creation of the Franklin County Digital Equity Coalition. Aaron is a two-time graduate of the Ohio State University with a master's degree in city and regional planning and a bachelor's degree in sociology. Amy Sheon is a full-time digital health equity consultant with Public Health Innovators. And her clients include health systems, health plans, government, industry, academic, philanthropic, and community organizations. She is expert at collecting and communicating qualitative and quantitative information using surveys, data visualizations, community engagement, social media, and virtual reality. Prior to starting full-time consulting in 2021, she led health equity programs at Case Western Reserve University School of Medicine, the University of Michigan, and National Institutes of Health. She holds a doctorate in public health from Johns Hopkins University, a master's in public health from the University of Michigan, and a bachelor's degree from Cornell University. As a user and champion of Conduent HCI services for over a decade, Amy is now proud to provide digital inclusion subject matter expertise consultations to Conduent and its clients. And of course, last but not least, we have Sarah Sable, who's a data analyst with the Cuyahoga County Board of Health based in Parma, Ohio. In this role, she's been heavily involved in primary and secondary data analyses, as well as assisting in preparing a collaborative community health needs assessment. She's also the data analyst and local site administrator for Healthy Northeast Ohio. We'll be talking about the website as well as Sarah's work in managing that site later today. Ms. Abel has 10 years of experience working in research and research administration. She holds a Master of Science in Social Administration from Case Western Reserve University. And now that we've introduced ourselves, we'll be turning off our cameras to maximize the audio quality of the webinar. We will rejoin you on video during the Q&A portion of the webinar. And with that, I'm going to turn this over to Aaron to begin our discussion of digital inclusion for community health.
All right, thanks, Jane. And hello, everyone. It's a pleasure to join you today. And first of all, thank you to Conduent for organizing today's webinar and the opportunity to join my co-presenters to discuss the connections between digital equity and public health. And just taking a quick look at the poll results, probably unsurprisingly, of folks who answered, it looks like the largest number are in state, county, or local public health roles. And then we have a smattering of folks in other health systems, other government, and then a few of us local digital inclusion practitioners also. So thanks for sharing that. It's always great to see who's on the call. So to get us started, I'd like to introduce a few key concepts for those who may be newer to digital equity and to establish a base of common understanding that we can all build on today. So first, a quick introduction to NDIA for folks who are not familiar with us. We're a national nonprofit organization that exists to support our community of more than, we got to update the slide. Oh, it's now more than 1,600 affiliates across all 50 states, most US territories, and an increasing number of tribal communities. Our affiliates are primarily community-based nonprofit organizations and public sector agencies working to address digital equity needs. And we do this in a few key ways. We provide tools, guidance, and training to practitioners doing the work on the ground. We advance digital equity policies at the local, state, and federal levels. We build awareness and sustainability for the digital equity field as a whole. And closest to my own heart, we also conduct research and data on the state of digital equity. Okay, so now that you know who we are, let's move on to a few core terms that are important to understanding when engaging with this topic. These terms were developed and adopted by our affiliate community, but have since been incorporated into both federal and state statutes. And a lot of these terms are likely familiar to many on this call, but we want to ensure that we all mean the same thing when we're using them. So the first term I'll introduce is the digital divide. This is the issue that we're trying to solve, right? It's the gap between those who have resources and skills necessary to effectively use technology and the internet and those who don't. The digital divide consists of a combination of individual and structural barriers, which is a concept you'll hear throughout today's discussion. And like so many other barriers to equity, we know that the digital divide disproportionately impacts certain groups, most significantly low-income households and communities of color. The next term we'll move on to is digital equity. So this is the goal that we're all striving toward, where all people are able to use technology to fully participate in society, democracy, and the economy. However, it's an ever-moving target, right? It's not something that we can just solve for and be done. As technology continuously evolves, people experience ongoing and changing digital equity needs. And so if digital equity is the goal, then digital inclusion is the work we all do. Digital inclusion refers to the activities necessary to ensure that all individuals and communities, including the most disadvantaged, have access to and use of information and communication technologies. Digital inclusion activities must also evolve as technology changes, and they require intentional strategies and investments to reduce and eliminate historical, institutional, and structural barriers to accessing and using technology. And one final term I want to introduce is digital inclusion ecosystem. So this refers to all of the organizations, programs, and resources that are working to advance digital equity in a given area. Digital inclusion ecosystems exist in all communities and states, but their health levels of coordination and effectiveness can vary pretty significantly. Less developed ecosystems may have significant gaps and duplicative services, and often organizations that don't even really realize they're a part of a broader ecosystem. Conversely, strong digital equity ecosystems have interconnected and complementary programs and partners who are working together to address all of the community's digital inclusion needs. So now that we've established some key terminology, we're going to look at some of the barriers to digital equity and just a couple of successful models for addressing those barriers. So we know that people experience varied and diverse challenges to digital equity related to internet access, devices, and digital skills. Some of the challenges are very concrete and are experienced individually, such as affordability of broadband or affordability of devices. But others are a bit more abstract. So people may have a hesitancy to seek support because of feelings of fear or shame. And yet others are structural challenges that must be addressed at a more systemic level, such as digital discrimination and digital redlining, which is a topic we'll come back to in a few moments. And it stands to reason if people experience digital equity barriers in these three categories, then the strategies to address these barriers are often organized similarly. There are lots of excellent programs and strategies to address various digital equity barriers, likely including some at your own organizations and partners that you work with. And while we don't have time to explore the full range of strategies that are out there on today's call, I do want to lift up two models that we found to be particularly effective at comprehensively addressing digital equity needs. The first of these is the digital navigator model, which may sound familiar to many on today's call, as it was inspired by the healthcare navigator model. Digital navigators are trusted individuals, usually situated in a community anchor institution, who serve as a single point of reference to help address all of an individual's digital inclusion needs. Digital navigators generally provide one-on-one support, often by helping connect community members to existing programs and resources. And if you're interested, you can find out a little bit more about the digital navigator model at the link you see on your screen. And we will all be sharing, all of your presenters today will be sharing a resource link at the end. So we'll have a slide at the end with QR codes where you can find out a lot more information, including information about the digital navigator model. And then the second comprehensive model I want to highlight today is the digital inclusion coalition model. Digital inclusion coalitions bring together organizations to coordinate services, advocate for digital equity, and pursue joint funding strategies. And there are a lot of components of the digital inclusion coalition model that are very similar if you're familiar with collective impact. There are a lot of similarities there. Coalitions also serve as an effective counterbalance to the strong influence that internet service providers often have on policymakers and in local decision making. And we're really seeing a proliferation of coalitions at both the state and local levels, particularly over the last year and a half. And I'd encourage everyone on today's call to explore whether a coalition already exists in your community and in your state. And if it does, that's really a great entry point to engaging with your local digital inclusion ecosystem. Okay, and the last kind of topic we want to cover today with my time is around policy. So we are in a critical moment for digital equity, with the field experiencing significant growth, increased awareness, and unprecedented investment. So I thought it might be useful to touch on just a few timely and important funding and policy developments. So initially, the Infrastructure Act of 2021, also known as IIJA, saw the most significant ever investment in broadband and digital equity, $65 billion in all. Including the first ever investment of $2.75 billion specifically dedicated to digital equity. And then also a $14 billion internet subsidy in the form of the Affordable Connectivity Program. So 2024 is a big year for the Digital Equity Act, that $2.75 billion investment specifically for digital equity programs. Each of your states is currently wrapping up the creation of a state digital equity plan, which will then lead to significant funding, so generally in the tens of millions of dollars for each state, for implementation later this year in the form of the State Capacity Grant Program. States will be subgranting out a portion of their capacity grant program funds to nonprofits and other eligible entities in their state to support digital inclusion programming over the next several years. And just a quick hint, if you are not familiar with your state's digital equity plan, I would strongly recommend finding that and taking a look for where there is alignment with public health and other health sector strategies and priorities, and looking for opportunities to be involved in the implementation of those strategies. Additionally, NTIA, the federal agency that's administering the Digital Equity Act, will also be leading a national level competitive grant program that will begin in the fall. And that's going to be for much larger grants, that most likely multi-state, multi-partner grants. So as I mentioned before, the Affordable Connectivity Program, or ACP, which many folks may be familiar with, is a program administered by the FCC that provides eligible households with a $30 per month subsidy to pay for internet service, or $75 a month for households on tribal lands. Over the past couple of years, ACP has grown into a very successful and frankly vital program, helping more than 23 million households across the country afford broadband internet subscriptions. However, the $14.2 billion for ACP was a one-time investment, and it is quickly running out. Current estimates show that April of this year will be the last month that there will be sufficient funding to provide the full ACP benefit to all enrolled households. And with no plan in place for renewing funding, the FCC has begun taking steps to wind down the program, including cutting off new enrollments in about 1 week from today, and requiring internet service providers to notify existing program participants that the benefit will be ending. And we at NDIA, along with our affiliates and peer organizations, continue to advocate for renewed funding to support the program. But as it currently stands, millions of households will be facing a tough decision in a couple of months about whether or not to continue paying for internet service once the benefit goes away. Okay, so on to some maybe more optimistic news. One important non-funding component of the Infrastructure Act is language directing the FCC to define and take measures to prevent and eliminate digital discrimination by internet service providers. So this directive acknowledges the structural and systemic nature of some digital equity challenges, which can't be addressed strictly through a subsidy like ACP or something like digital skills training. While digital discrimination can manifest in a variety of ways, including pricing practices or marketing and customer service practices, perhaps the most clearly defined is digital redlining, which, if you're familiar with housing redlining, it is very similar. So it's a practice of providers upgrading infrastructure in certain areas that promise larger returns on investment, while underinvesting in other, primarily low-income urban areas. And Amy's going to touch a little bit more on digital redlining here shortly in her remarks as well. And then the final policy development I'd like to highlight today is the creation of broadband consumer labels, which will be hitting the metaphorical shelves starting in April. So similar to food nutrition labels that we are all so familiar with, the broadband labels will present consumers with standardized information about different internet plans across all providers. The labels will appear at the point of purchase, so whether that's in the store or online, and are intended to simplify the process of shopping for plans by increasing transparency in pricing and service quality. But because the labels must also be machine readable, they will also generate a valuable new data source about the range of internet options available to consumers. So those of us that work in the data space here are very excited about that. So that wraps up my high-level overview of key digital equity concepts and policies. And now I'm pleased to turn over the discussion to a great friend of NDIA and advocate for digital equity and its role in public health and healthcare spaces, Amy Sheon.
Thank you so much, Aaron. And thanks, I really want to add my thanks to Conduit for organizing the webinar and to Aaron and Sarah for participating. We have an all Ohio origins team here, and to all of you for attending. I'm going to start with presenting 4 reasons that digital inclusion matters to people who are concerned with community health. First is that efforts to address digital inclusion contribute to public health objectives. Digital readiness was essential for getting healthcare during the pandemic, and many pandemic-related digital healthcare shifts are here to stay. Video telehealth is generally superior to audio-only connections, and patient portals have also become invaluable. Portals give people access to medical records and the ability to communicate with the healthcare team, and they can also facilitate core public health functions such as immunization, surveillance, and emergency preparedness. Digital inclusion also enables people to address health-related social needs, such as education and employment, that arise because of social determinants of health. Digital exclusion amplifies health disparities because the population groups with the greatest health disparities obtain the least benefits from the internet. Overall, disparities in having any use of the internet have declined dramatically in the past 10 years, thanks in part to the great work of folks like NDIA and its affiliates. In fact, any use of the internet for people who are Black trails that for people who are white by just a couple of percentage points, and people who are Hispanic are actually more likely to use the internet than people who are white. However, there are still very large gaps in any use of the internet for people without college education and for households with less than $50,000 in income, and especially people in households below $30,000 in income. But even these gaps mask extremely consequential disparities. If you look now at the second column that was added in blue, it shows the proportion of people with home internet connections as opposed to any internet that we were looking at a moment ago. And the third column in black shows the percent whose only internet access is on a smartphone. And you can see here that there are striking differences in the proportion of people who are Black and Hispanic and who have no college education or lower income that have no home internet. So not having home internet goes hand in hand with being dependent on a mobile device, a mobile connection for internet access. Mobile connections can be especially limiting for people who are trying to use two-way video, such as for schoolwork or remote work, and for larger households. The public health and healthcare sectors have superpowers for achieving digital inclusion objectives, and these impacts can bring benefits back to the health sector. These include being able to identify and reach everybody who's not connected to the internet. Digital readiness screening fits in with widely used health sector screening for health-related social needs, and electronic referral systems are starting to be widely used, making it easier to connect people with community resources to address non-medical needs that affect health. The digital inclusion community also needs to demonstrate that the Infrastructure and Jobs Act broadband investments are having an impact. The health community has ways to do that. Health community can be very influential in addressing hesitancy to use digital health tools like telehealth and portals. So that's a great way to demonstrate the impact of digital inclusion efforts, especially if digitally inclusive approaches such as digital navigation are used to encourage patients. Data on patient use of telehealth and portals are automatically tracked, which could be invaluable for enabling the digital inclusion community to demonstrate the impact of their work. Just 3.5 months after the stay-at-home order led to an overnight digital transformation of healthcare, an article was submitted for publication showing dramatic disparities in telehealth use for 148,000 patients. More recent publications on digital health technology report on millions of patients at a time, and they're showing geospatial disparities that are invaluable for both digital inclusion and community health. The hyperlocal CDC Places data with information on health outcomes, risk factors, and prevention should also be invaluable for organizations that are applying for or reporting on their digital inclusion funding. It's great that broadband subscription data was recently added to the CDC Places website, but I'm hoping that data on broadband and adoption use, broader set of variables will routinely be included in public health data sets and analyses. Finally, health disparities and digital exclusion largely affect the same groups of people and for the same reasons. So the two sectors can have a greater impact on their interconnected interests by working together than either would have working in isolation alone. This busy slide is just meant to highlight ways that digital inclusion and community health use common methods such as asset mapping and needs assessment, but they use different vocabulary. Most important, I think, is that health and digital inclusion efforts should be synergistic because digital inequities and health inequities share a common root cause. And that root cause is most apparent when you look at geospatial visualizations. In Philadelphia here, we can see that elevated blood pressure is most common in the very same neighborhoods that have a high proportion of people without broadband internet subscriptions. A landmark 2022 study showed that people who live in neighborhoods with the highest proportion of people who are white were far more likely to get offers for fast internet service than were people living in neighborhoods with the lowest proportion of residents who are white. Yet the offers of slow internet were for the same price as offers for gigabit service in wealthier, whiter neighborhoods that may just be a block away. Many cities that had been economically redlined after the Depression are digitally redlined today. Going forward, digital redlining is illegal thanks to the persistent advocacy of our NDIA friends, but the damage has been done, which should be of concern to community health. People living in privileged neighborhoods had a 20-year head start on use of the internet compared to people in neighborhoods that have been subject to pervasive resource deprivation and environmental health risks that are often associated with historical redline. So now we're going to hone in on what can be done to address digital equity disparities. First is that the health sector needs trained staff to do digital inclusion screening and to partner with digital inclusion organizations for referrals for people who are not digitally ready for health. Digital navigators, such as Aaron described, are trained to do this. Thanks to the ACP wind down, there may be thousands of trained digital navigators who could be put to work in the health sector. And miraculously, there may actually be resources for digital inclusion in healthcare. As of January 1st this year, Medicare Advantage plans are required to screen all of their enrollees for digital health literacy and to address gaps. Medicare and some Medicaid programs also have new reimbursement codes that will pay for community health workers to perform principal illness navigation and integration with community health services. Digital navigation work could potentially be reimbursed with these codes, but either digital navigators have to be trained to become community health workers, or CHWs must get trained in digital navigation because many would not automatically know these skills. Now, as I described earlier, community health practitioners could do much to assure equitable impact of the internet. And one key opportunity is to link mandated digital inclusion plans with community health needs assessment and health improvement plans. This particular state's digital equity plan mentions health 98 times, but their state health improvement plan does not mention broadband or internet at all. Not to pick on this state, because to date, few health needs assessment and health improvement plans address digital inclusion. With that said, I'm pleased to share a contrary example and passing the mic to Sarah, who's going to just share a case study that shows how Northeast Ohio has incorporated digital inclusion into their community health work. Sarah, over to you.
Thanks so much, Amy, and sharing sentiments. Thank you all for attending today. So yeah, in my time today, I'm going to be sharing some about our efforts with Healthy Northeast Ohio, mainly related to making digital equity data and resources available locally. And I know we did do introductions, so I did just want to give a very brief shout out to my counterpart in this work, Libby McGraw. Libby is the Regional Community Health Improvement Manager at the Center for Health Affairs, which is a regional hospital association. And Healthy Northeast Ohio is run through a partnership between our two organizations, so the Cuyahoga County Board of Health and the Center for Health Affairs. So just to start to give a quick background on Healthy Northeast Ohio, it is available at healthyneo.org, and it is a publicly available online resource for regional population health data in Northeast Ohio. And I did want to mention that the website is built on the Conduent web-based platform. The Healthy Northeast Ohio website did launch in late 2019 with a mission to improve and support community health across a 9-county region by providing stakeholders with access to vetted population health data and resources through a publicly available platform. Currently, we have about 25 organizations who partner with us, with our main partners being hospitals and local health departments. And then just very briefly, the vision behind creating Healthy Northeast Ohio was to create a shared data infrastructure that could be used by those working to improve the health of our region, to monitor population health data, and also to track progress on health improvement. The site was also meant to bring data from multiple sources, in addition to other resources, together into one place to make them more accessible to our partners. And on this slide, you're just seeing a few examples of some of the ways that the website can be used. So for example, data on the platform has been used to support community health assessments or community health needs assessments. Some of our site users use data for grant applications, program planning decisions, etc. So the platform currently includes more than 300 health, quality of life, and social determinants of health indicators that come from roughly about 30 trusted sources that are updated on a regular basis. So for example, we do have data from the CDC places that Amy shared earlier. And data on the platform is available at a variety of geographic levels, so it does allow our site users to view data at more granular levels. And then on this page is where our site users can go to search for data, but also to access curated dashboards that we've created. So those can include both locally maintained data that we've added, as well as data that Conduent maintains for us. So next, I'm going to highlight the digital access indicators dashboard that we created to try to be responsive to local efforts being done in the digital equity space by making digital access data and resources more available within our region. So these are two screenshots from the digital access indicators dashboard page. And the dashboard includes some key digital inclusion and navigation resources that Amy actually so kindly helped us to identify from organizations like NDIA. In the second screenshot, you can see the indicators, I know it's probably small, that are included in this dashboard, but they are available from the state down to the census tract levels. So 3 of these indicators are 5-year estimates from the US Census Bureau's American Community Survey, and the remaining 4 are annual estimates from the Claritas consumer profiles. And just quickly, Claritas is a nationwide market research group that provides demographic, spending, and behavior data by various geographic levels. And I did want to mention that we made the decision to pay extra for these Claritas indicators, again, as a way of making digital access data more available to our partners because they wouldn't be able to access that otherwise. So if a site user were on that dashboard and they clicked on an indicator, they would be taken to what's called the indicator detail page. So again, this is just an example. But on this page, they can read more about the indicator, they can see the current value as well as any available comparisons. These comparisons can help to get a sense of how a community is doing compared to other locations and targets, and also how that indicator may be tracking over time. If available, this page will also include breakout data. So for example, this indicator has age and race ethnicity breakout data that you're seeing to the right, which can be helpful when trying to identify disparities, in this case, for example, that may exist in digital access. The indicator detail page also includes a map that can be helpful in identifying geographic disparities and knowing which areas may need to be focused on. So I've also included a map from the demographics dashboard on the site in the middle that shows the Black African American population by zip code within Cuyahoga County, as well as another map that shows adults with diabetes. So looking at these maps side by side, we can see overlaps between lack of digital access, race, and health status, in this case, diabetes in Cuyahoga County. So I guess just further driving home the point that Amy shared earlier. And then next, I really briefly wanted to share some of the digital equity resources that are available on the platform in addition to the data. So first is the resource library. Libby and I actually maintain these resources with the exception of funding opportunities that Conduent maintains that are from mainly national foundations and the federal government. And the resources in this resource library could contribute to asset mapping in a community. Conduent maintains the promising practices database that's available on the platform, and partners can use this to identify programs that range from good ideas to evidence-based practices to implement within the region. So again, for sake of example, I did a keyword search here for digital access. And to the right, I'm just highlighting one of those practices so you can see what information is available about each one. I also wanted to mention that given the important role community health workers play in public health, this database also includes several evidence-based practices if you were to do a keyword search for community health workers as well. And these promising practices have been very helpful in supporting our partners from moving from data to action. So in my last few minutes, I'm going to shift into sharing about how digital access data has been incorporated into the Cuyahoga County Community Health Needs Assessment process for the last 2 cycles. In Ohio, collaborative CHNAs are conducted with hospitals and public health departments working together. So in our 2019 CHNA, again in Cuyahoga County, we conducted a community survey. So on this screen, you're seeing the digital connectivity questions that were included in the adult version of that survey. And you can see that the results were broken out by gender, age, income, and race ethnicity. And this data is available on the Cuyahoga County page on Healthy Northeast Ohio, as well as in our resource library. And including questions like these in CHNAs is one way that public health and hospitals can contribute to collecting and sharing digital inclusion data more broadly. So again, just briefly, the questions that we included were how do you prefer to get or access information about your health or healthcare services? So response options for that question included things like internet searches, a social network like Facebook, text on a cell phone, or a medical portal. We also asked which place do you usually go when you are sick or need advice? And those responses included things like the internet and telemedicine. And then lastly, we asked, do you have access to the internet at any of the following places? And those response options included things like at home, on a cell phone, at work, at another location such as a library, or no access. And the graph at the bottom corresponds to that last question. And this is helps us to see that the biggest gaps existed by age and income. So here you can see that accessible and affordable healthcare was one of the priority areas identified in the Cuyahoga County 2022 Community Health Needs Assessment. We did not conduct a community survey in that most recent CHNA cycle like we did in 2019. But however, as you can see to the right, indicators from the Digital Access Indicators dashboard that I showed earlier were included as secondary data in the Cuyahoga County CHNA. And the importance of digital access was highlighted as impacting not only access to care, but also employment. Again, in the screenshot on the slide, and that was from the social determinants of health section of the report. So again, just wanted to briefly share some about our efforts, the ways that we've tried to make digital access data and resources more available to our partners within Northeast Ohio. So I appreciate your attention, and I think that wraps up my section. So Jane, I'm going to turn it back over to you.
Thank you so much, Sarah. And that does conclude our presentation and will lead us to the discussion portion of our webinar. So please, I'm already starting to see more questions pop up in the chat. So please feel free to ask any questions to all panelists in the chat, and we'll hopefully get to those questions. And for this part of the webinar, we'll go ahead and turn our cameras back on so that we can have this conversation more face-to-face. And we did have some questions come in that we're tracking during the webinar. So Sarah, I'm going to address the first one to you, maybe starting off, and then Amy, if you can add on to this. Since we're talking about kind of bridging these two sectors, what have been some of the biggest challenges to working across the sectors, and how have you been able to address them?
Did you want Sarah to start?
Yeah, I was going to direct that to Sarah just as she was coming off some of the experiences she was having. And then Amy, if you wouldn't mind sharing after that.
Sounds good. Thank you so much for that question, Jane. I think one of the biggest challenges that I have seen can be around a lack of awareness of efforts that are being done across sectors. So for example, with digital inclusion and public health, where each sector is working in their lane and may not be aware of what each other is doing. For example, public health saw the challenges of lack of digital access during the COVID-19 pandemic, but may not have known who to partner with in the digital inclusion space. And then I guess more from the Healthy Northeast Ohio lens, we work with public health and hospitals who each have their own needs, legal requirements that must be met. So it can be a challenge to ensure that each sector's requirements are met. And one way that both of those sectors can engage in the digital inclusion space is to include digital equity data in community health needs assessments, community health improvement plans, which I tried to showcase a quick example of that. But Amy, I'll turn it over to you.
Sure. So those are among my top points, that the two sectors don't really necessarily, well, the digital inclusion sector knows that the health sector exists, but they don't know how to jump in. And from my work with a lot of health systems, it's apparent that digital inclusion could fall under a dozen different areas within a health system. And so for somebody in a community that wants to reach out to a health system and engage somebody in their digital equity planning, it's hard to know who the right person is to connect with. Another, I think, big limitation is that the health sector and many other sectors are not aware that teaching people a digital skill is different than, say, health education. So, I've seen many times a health system that their method of helping a patient use the portal is the doctor on his way out the door says, oh, here, let me take your phone and I'll download my chart for you, which is not good for a whole lot of different reasons. So those are a couple of the big gaps that I see.
Thank you so much. And maybe to bridge that, for you, Erin, what advice would you give community health planners that are looking to do work in the digital equity space? What is the first step they should take?
Great question. A couple of first steps, I'll just rehash a couple of things I mentioned. First, take a look at your state digital equity plan. One of the requirements of states is to look for alignment with existing state goals. So that would include like the state health improvement plan. And similar in your own community. So take a look at if there are, so that's why I suggested looking for a coalition to see if one exists already as a good entry point, but understand the ecosystem. We talk to digital equity practitioners about the importance of asset mapping and understanding all the assets that can be brought to bear in the community to address digital equity needs. But as Amy said, they just like don't know where to start a lot of times with the healthcare field, with public health. So making yourself known as a partner and available resource is really key. And then, yeah, collecting some of your own data. And I know there's a question we might get to in a moment about surveys. So can offer some suggestions there too.
Yeah, I was actually going to go there next. A question from Kate about, are there any standard questionnaires or survey instruments that have been developed to incorporate digital access inclusion or digital access, digital inclusion, et cetera, in a community health needs survey? Erin, since you already touched on that, if you wouldn't mind sharing some of the best practices you know about, and then I know Amy would love to jump in on ideas as well.
Yeah, I think Amy could speak to how well or if surveys have been incorporated into public health planning around digital equity. But what I can share is a resource that may be adaptable. So I'll drop that in the chat. Hopefully that's there. There's a link to that is a digital equity survey template that we developed. We developed it for states to kind of assess digital equity at the community level. But there are a lot of questions in there that might be useful. And the questions are kind of organized around some existing national data sets, including the current population statistics, which does a biannual survey about internet and computer access. So you could take a look at that resource from the Bureau of Labor Statistics also and kind of see what data is collected at the national level and then think about how to incorporate similar questions about computer use and comfort using different devices and technology.
Yeah, so what I would jump in with is I don't think there is a standard at all for including for what questions would be included in a community health assessment. What I have the most experience with is health systems that are now looking at doing digital inclusion, digital readiness screening. And I will tell you that every single word in every question needs to be thought through carefully because in the health context, you have to link the questions you're asking to what you're going to do about it. And just as there have been lawsuits over, what does the word is mean? Literally every word in the way the questions are asked makes a difference. So of course I recommend consulting with experts, but there's starting to be some validated instruments coming into the literature, but you have to really look and see what populations it's been validated. I saw one that was validated in parents of pediatric patients. And so, of course, young parents have very different digital readiness needs and levels than a population that's perhaps older adults.
Thank you, Amy. Yeah, I know those are best practices we have in community health about really looking at all of the details, all of the words, also validating what the community uses. And, sometimes what we ask isn't what is heard depending on the community we're serving or we're surveying. I'm going to ask this next question, I think direct this back to Erin and Amy again. Erin, can you talk a little bit about how clinicians, public health professionals, including community health workers, are being trained to use the tools to improve community health?
So I will admit, like, I am not an on-the-ground practitioner, so I don't know that I can speak to like the specific, like most successful model. I would actually guess that many people on the call could probably share more specific examples of like what has worked. But I'll note like there are a few hospital systems and public health partners that are incorporating digital navigator work into their work, and so helping to like serve as that point of contact, so the clinicians don't necessarily have to be trained in how to teach someone digital skills. What they need is to know how to connect them to an existing program or resource in the community. So we're not necessarily suggesting that everyone learn how to be a digital skills trainer, right? Like that's just not practical. What's important is to develop this interconnected ecosystem so folks that you work with like know where to direct people and know what resources exist. And in some cases, we are seeing more overlap, and where some of those, like I said, some of those digital navigators and support systems sit within public health or hospital systems, but just as frequently, it's that connection to like know who to talk to at the library or know which community anchor institution can provide devices if that's someone's need. So kind of understanding what the ecosystem looks like.
Yeah, thanks, Erin. And Amy, I know you covered this a little bit in what you presented. Do you want to add on to that?
Yeah, sure. I would underscore what Erin said about it's not necessarily the highest and best use of a digital health navigator to train them to do the basic digital skill training. So I really have always recommended, kind of farming that out to the digital inclusion experts. NDIA has some great advice out there, and that is there's no need to invent your own digital inclusion curriculum. They have collected and kind of curated a wonderful list. On the digital health navigation side, it's still kind of the Wild West, and there are a few curricula out there. I'm working on training with 3 or 4 different clients, and they're all kind of taking different approaches. So there's a lot of opportunity here to come up with the best practices and best ways to do it.
Thanks, Amy. And we had a question about, I think, Cuyahoga specifically. So Sarah, I'm going to direct this to you. Does this case study apply just to Cuyahoga County or across all of Ohio? And how is the Ohio State Department of Health involved?
Sure, thanks, Jean. So as I shared, the Healthy Northeast Ohio platform itself serves a 9-county region within Northeast Ohio, and that was picked because it aligns with the footprint for the Center for Health Affairs. Again, a hospital membership association in Northeast Ohio. So again, our partners are from that 9-county region. The data and all of that on the platform would be available for all of those counties. The CHNA, obviously, example that I shared was just specific to Cuyahoga County, but we do have county pages for each of our 9 counties on the platform where all of the various CHNAs can be accessed if you're interested. And then as far as the Ohio Department of Health, we definitely have had some outreach to them, just to make them aware of what we're doing and our efforts. I think more recently we have re-engaged with them and exploring further opportunities for engagement with them.
Thanks so much, Sarah. And we have another question. I'm going to direct this one to Erin. When ACP runs out, what is to stop incumbent ISPs from practices like redlining?
Yeah, so first of all, redlining is not legal now. And so the guidelines that the FCC has been given through the Infrastructure Act are not contingent on ACP. They're moving forward with those. They're developing rules right now. There are some lawsuits that are testing those rules as we speak. But the FCC is charged with identifying and eliminating digital discrimination, regardless of whether or not ACP exists. The challenge is digital redlining and discrimination will impact people more when they don't have a subsidy to help pay for their service. And so we and others in the field will need to be much more vigilant about identifying different forms of discrimination. So we've clearly defined redlining, but people aren't marketed to because a provider doesn't see them as, a likely customer, for example, and so they don't know what services they may be able to access. That would be a form of discrimination that you may not realize if you're an individual because you don't know that it's happening to a bunch of your neighbors also, right? So our role is to help define and identify and put a name to these different forms of discrimination, and then help communities to submit to the FCC through their kind of process when this is happening and kind of like raise this issue. So, the ACP does not directly influence any of the digital discrimination rules, but it just means that we need to be that much more vigilant about when that may be happening.
Thanks, Aaron. And I'm just looking in the chat. Sorry for all the eye movement, trying to pay attention to the chat as well. And I think those are all of the questions that came in, but there's been really wonderful conversation in the chat. It looks like quite a few folks are going to the NDIA's Net Inclusion Conference in a couple of weeks, and Conduit will also be there. And there seems to be a lot of interest in continuing this conversation and bridging these two sectors. We're talking about public health and telehealth and net inclusion. So I'm giving you all a little bit of time. Please connect with each other. And thanks, Aaron, for continuing that and bridging that. So on the screen right now, we do have some QR codes for each of the resources we spoke about. So if you'd like to learn more about any of our speakers or the resources that they shared, please scan the following QR codes. We also received quite a few questions about whether this recording will be made available. And yes, after the webinar, we will be sharing a recording of the webinar and also just sending out an email with the information that you need. And at this point, it looks like we're just about out of time. And we would just love to thank Aaron, Amy, and Sarah again for their time. And of course, thank you for those who were able to stay till the end today. We had a really nice crowd, a lot of nice conversation, and we hope that this information was helpful to you in the work that you're doing. And it's just the beginning of some of the work in bridging these two sectors. So we've put our main contact email on the slide here. And so if you have any questions or if we can support you and your organization in any way, please let us know. For our current clients who are on the webinar, please feel free to reach out to your account managers or project manager if you have any questions after today's webinar. Thank you again, everyone, for joining us today. And that concludes today's presentation. Please have a great rest of your day.
Thank you.
One.